I'm Wendy Aylworth, and my first cousin sent me an email in June. She wasn't ever willing to knock the Canadian system, but my cousins are Canadians, and I guess she saw some comments I'd made on someone to Facebook about the Indian healthcare system. She sent me this email and told me what had happened that week. She said, Wendy, you know,
oh, wow. Yeah.
I could tell you a lot about things.
My parents are over there, my brothers are.
I just had to take Lita, who's her 29-year-old daughter, into the emergency room. She said what we thought was a bad cold all this time, and she said, I took her in Monday, sat in the hospital waiting room for 5.5 hours. She said about 20 people came in after we got there, and the triage person took them all back first.
We really had a good comeback.
She said, you know, even though Lita was in excruciating pain, we'd already checked in with triage when we came in. They knew she's a heart patient. They wouldn't take her back. She said when they finally took her back, they gave her something for pain and nausea, because she was vomiting by that time and spitting up blood, and told her to go get an ultrasound at this other place in town the next day. Well, during the night, she couldn't make it. She woke me up and she said, Mom, please take me back to the hospital. And so I took her back. But before I went, I called the emergency department, and I said, you know, she was just in, and we're coming back, and please take her back right away because she's really, really sick. And the emergency the person said, how dare you talk to us that way and abuse us like that? She said, it wasn't abuse, I was just trying to see if they were busy or not. She took her bad daughter in. The entire waiting room was completely empty, but the triage person just sat there. They wouldn't take her back. I guess this is a way to show her who was boss. When they finally took her back, they felt her abdomen. Well, first my cousin said, did any of them the day before, did they look in her eyes and see that her eyes were yellowed from jaundice? No. Nobody did. Did they feel her abdomen? No. Did they do this? Did they do that? She had a whole list of things that they should have done and they didn't. They finally took her back and they felt her abdomen, and they said her liver's way distended and it's hard and it feels like there's some kind of mass in it. They took an x-ray, they did a CT scan finally, which should have been done a long time ago, but you have to go on a wait list. That afternoon, well, they finally put her in the hospital, gave her a bed, and that afternoon they did a biopsy, and they said, well, the biopsy results will be back in 8 days. But we think it's probably cancer, and it's probably malignant, and there's spots on her lungs from this x-ray, so it's probably spread to her lungs. I got this email Wednesday night. So I called my cousin, I emailed her, I was trying to find out what could be done, and I'm talking to all kinds of agencies in Canada. I'm emailing, I'm messaging, I'm contacting people on Facebook. I was doing everything I could to try to find somebody that could help her. I found out there was no way she could get to another facility that had, well, my cousin told me, first of all, that the specialist was going on, if she thought it was an oncologist, they led her to believe the oncologist there at her hospital was going on vacation that night and wouldn't be back. So her appointment with him was July 6th. My cousin died the night of July 9th. But just to tell you the rest of the story, I was trying to get a hold of somebody. They did, since the oncologist is going on vacation, the family doctor would have had to give her permission to transfer to another oncologist. The nearest oncologist was a 2.5-hour drive away. My cousin told me that Lita, my cousin that's 29, she couldn't even move without retching. You know, the vomiting was so bad. And she said, I don't think we can get her there. And I said, well, because I found out from messaging other people that would require an ambulance to take her to another facility, because you couldn't just take someone in a car if they'd already been in a facility and had left without permission. So I said, how much would the ambulance cost? And she says, we just don't have that kind of money. I said, how much would it cost? She wouldn't tell me. But even so, she couldn't get into the hospital without permission from the family doctor. And I said, well, why won't the doctor give you permission? She says, I don't know. She says, but she's a really nice lady. I'm like, there's something wrong with your system here. And it wasn't at that time, you know, I got to thinking about it after talking with her, and I got to think, well, why aren't they giving her this medication, this IV medication? Because I had surgery on June 2nd, and I have a horrible time after general anesthesia, vomiting and all that, just for a long time. So I called her up, got a hold of her Sunday night, and I said, well, why aren't they putting her this stuff in her IV? They gave me this stuff after my surgery, and I had absolutely no nausea, not a touch of it this time. Why aren't they giving her this in her IV? She said, oh, she's not on an IV. And I said, what? She's a person they are almost certain has cancer, that it's malignant. They can feel a mass in there. They see spots on her lungs. She's in the hospital and she's not on an IV. She's getting dehydrated. She said, oh, they told me the sips of water should be fine. She's able to take sips of water, and I'm going, what? So I looked up stuff on the internet, emailed it to her quick. Well, Monday, finally, she got her IV. Okay? But all this was really too late. They wouldn't let her see an oncologist. Turns out there was no oncologist. The family doctor said she could just use the cancer center here at our hospital. Well, the cancer center didn't have an oncologist, and that was the oncologist, the guy who was on vacation. In addition to that, my cousin was so ill, my cousin, not just the 29-year-old, but my cousin herself was so ill, she started telling me, there's no way I can drive all the way to Calgary, where the nearest cancer center and oncologist was. She says, I can't drive there. She says, I have a heart condition. I'm on a waiting list. It just got more and more ridiculous. She was so ill she could hardly walk from the parking lot. She went home at night to sleep because they didn't even give her a cot in the hospital to sleep next to her daughter. She says, I can hardly walk from the parking lot down the hall to Lita's room. She had a walker. She has crippled feet, heart condition, was on a waiting list for getting an angiogram. Well, on June 30th, she finally got told she had an appointment to get the angiogram in Calgary, a 2.5-hour drive. She says, I can't even drive that far. So she couldn't get her daughter up. Both of them, the care system, if they really cared, would have taken my cousin, my own cousin, first cousin, and her 29-year-old daughter, put them in an ambulance, or life-watched them up to Calgary, where they should have been. They would have been. They would have been life-watched here. But they can't spend that kind of money in Canada. And even if a girl's 29 years old, oh, she has a heart condition. Too bad she's not worth the money. And that's what I think happened. They did test for her heart medication. She was supposed to get liver enzyme tests. They had tested it in November of 2008, and the liver enzymes were elevated. This is the family doctor doing the test, of course. The family doctor didn't say anything. Didn't say anything. I don't know why. I can only conjecture she didn't want to be bothered. Perhaps there was an expense. It would cost somebody some money. Whatever it was, she didn't say anything. And why wouldn't she refer my cousin, my 29-year-old cousin, to an oncologist in another area? Why? Was it CYA? I wonder. She didn't want to see another doctor seeing her patient. Anyway, thank you.